Kenyan healthcare workers have revealed the number of backstreet abortions have increased since the United States cut aid to family planning programs. Now, U.S. President Donald Trump's administration reduced aid in a bid to curb abortions. It's known as the Mexico City policy or the global gag rule, and dictates that any overseas organization receiving American aid have nothing to do with abortions. But Kenyan authorities say the policy is having the opposite effect. The aid cuts have left thousands of women without access to contraceptives and family planning counseling. Well, Kenya is not the only country affected. American aid cuts are affecting the work of non-governmental organizations who offer family planning services in Burkina Faso. Some of these organizations may have to stop their work come next month. Here's CGTN's Tulisha Balala.
In the Burkina Faso city of Kampala, Aminata Nikiema is making her regular visit to the state clinic. She cycles 10 kilometers with her youngest baby. Aminata is attending a family planning session by NGO Marie Stopes International.
I am 33 years old and already have 3 children. I want 3 more, so all I want now is to be in good health so I can work in the field and take care of them.
The NGO has dispatched 10 of its nurses to remote parts of the country, where the state cannot afford to cover. They offer free contraception, advice on family planning, and sometimes perform abortions. But their funds are drying up. The Trump administration has stopped funding foreign NGOs carrying out or offering advice on abortions.
The clash of January 2017, it was like a death knell because the Americans had committed themselves and were providing a lot of the finance. As a result, we, the poor countries, were forced to, in reality, change our plans. So by the time all the programs funded by the United States are implemented, we will have a serious gap in the completion of this demographic transition. So really, this change has created a real shock.
MSI is one of the largest NGOs in Africa that offers free contraception and family planning services. All its operations have been entirely funded by a $1.25 million grant from USAID. The contraceptive programs are crucial in Burkina Faso, where the fertility rate is 5.5 births per woman.
Here in Kampala, we see Marie Stopes International as lifesavers. Almost all the women in the village manage to have a gap in pregnancy period between each childbirth. So if they stop their work, it would be a major handicap for us. Without them, I don't know how we would manage to access the family planning methods.
I have a 7-month-old baby. I came for family planning to be able to make provisions so that I won't quickly have another baby.
UK aid has stepped in to keep MSI afloat until June. But uncertainty and concern is growing as to what will happen to their programs and the millions of people they serve. Tulisha Balala, CGTN.
And to get more insight on this now, I'm joined in studio by Dr. John Nyamu. He's an obstetrician gynecologist. Dr. Nyamu, thank you for joining us here on the link. First off, let's start with Kenya's situation here. Under what circumstances is abortion allowed in Kenya?
Well, in Kenya, abortion is allowed under 4 circumstances. That is the Constitution of 2010 states that, that is Article 26(4), states that abortion is not permitted unless, with the help of a trained health professional, the health of the mother is in danger or the life of the mother is in danger, or in case of emergency or in case of any other written law. So there are 4 circumstances under which abortion is allowed in Kenya.
But we still see that in Kenya, particularly, of course, abortions, as we do understand, are on the rise. What kind of numbers are we talking about, and why exactly are people resorting to unsafe abortions?
According to the Ministry of Health Studies and, of course, with the partners, in 2004, the number of unsafe abortions were recorded to be 300,000. And in 2013, that is 10 years later, the number of unsafe abortions were 465,000. That's almost 500,000, which were reported in the Ministry of Health facilities. And the main cause of this unsafe abortion is there are two. One, there is no policy. The government does not have any policy on management of unintended pregnancies. And most of the public health sector services do not entertain abortion services. They only manage incomplete abortion, or rather these clients who have had unsafe abortions. So what I can say is that the ministry does not have a policy in form of standards and guidelines to unpack the constitution, and therefore most of the women go to the quacks or untrained people to have their pregnancies terminated, and then they rush to the Ministry of Health facilities for finishing or cleanup.
So there have been donor aid, though, particularly in some countries across the continent that have assisted women in terms of trying to procure abortions here. But there have been concerns that aid cuts are in fact now driving women to engage in illegal abortions. How concerned should African countries and governments be about this?
First of all, Africa is a developing world, our country, and most of the funds are limited. And although there have been strategies to increase the health budget, this has not been possible. So most of the African countries rely on donor aid, and one of the main donors is USAID. And of course, several organizations in Kenya who have been supporting women to prevent unsafe abortion have been relying on donor aid. And this, of course, has been stopped. And basically, most of the women cannot access contraceptive services, which are the main pillars for prevention of unintended pregnancies. So, yeah, that's what is happening.
So, when you look at across the continent, because you looked at Kenya's problem, though, and you said up to about 500,000 women procure illegal abortions here. So, what efforts, though, are being done to reduce maternal deaths in Africa?
Well, for maternal deaths, what we know is that we have to look at the causes of maternal deaths for us to be able to prevent. And the causes are mainly the big five. It's called the big five. One of them is unsafe abortion, is of course contributes about 13%. And severe bleeding PPH contributes about 25%. And of course, there are others like eclampsia, that is hypertensive diseases in pregnancy, and also obstructed labor. And I think the main thing, if you want to look at the strategies of maternal health, then you have to look at these causes. And probably one of the main strategies that we have is family planning. Use of family planning, of course, will reduce the unsafe abortions. And during delivery, we need clean deliveries. And of course, we have skilled birth attendants. And of course, there's emergency obstetric care to prevent obstructed labor and also PPH.
Right, Dr. John Nyamu, we'll leave it there for the moment, but thank you very much for your insights on abortion in Africa.